So basically, this is just a quick review of what I'm looking for in the PowerPoint presentation as you go through that. So I've asked you all to record a PowerPoint presentation. I figured that would be a little bit more time efficient instead of using all of our class time. I'm going to share that back with your advisor through the URL, so he or she will have access to that. So I've organized that information on your Echo and Zoom. So it takes about 15 minutes to watch that. I also explain a couple of things that I'm going to explain today. But my talk is about 10 minutes. So that would have been a little long. I would have wanted to shorten that up. I did it better the first time. So I would recommend you maybe record a couple practice trials and sort of practice your timing, make sure you have everything organized. So you only have to submit it once to me, but you can run through it a couple of times and see which one you like. You know, if it's over by a few seconds, I'm not going to worry about it. If it's 10 minutes long, that's probably too long. So try to keep it around that 7-minute mark. I really don't want it to be 2 minutes. That would be way too short. I don't think you'd be able to cover everything. You know, I'm not going to be super harsh on a few seconds over. So don't kill yourself trying to keep it at 6:59. So I'm going to go through these components today to sort of show you how I expect it to look like. I'm going to give you a few slide tips and how I'm going to grade it. It's all in the syllabus, just in case you have any questions about that. So these blue slides are going to be more sort of instructions, and the white slides will be the presentation. So what I'm looking for is your title with all your authors. I would use full names, not nicknames. Put your credentials as a student physical therapist. Typically, we have the advisor go at the bottom. If you have other people working on this project, like outside people helping you, they should go on that. So it would certainly look something like this. Now there's a lot of Lexington and Kentucky's in here, but basically this is the whole team of physical therapists at UK Sports Medicine, plus the one of the PT residents. We actually have an additional person that's joined our group that's now on this component. So you can put your credentials or student PT if you're an ATC or something like that, or other certifications, you can add that. At this slide, you're not going to name all of these people. You're just going to say, these are our co-authors. So the background is where people can sort of go off on a tangent and can get a little long. I would say about 3 slides to sort of build your case. Sometimes it's going to need 4. It's rare, but sometimes you can get away with 2. So think of the audience. So all your classmates are listening to you and I'm listening to you. So we sort of know what some of this stuff is, but try to use terms that we understand. If you're going to start talking about a specific pathology, just a quick sentence to reference it. You don't need to go into the entire history of what cerebral palsy is or what a fracture is. Please insert your references as you go. I don't know if you've noticed as I've been presenting, you probably haven't, but I try to always put my references right after the statement. I don't usually like those at the end. One, nobody ever has time to look at them. And if you're making a point and it's sort of interesting and I want to capture that information, I would recommend putting it right at the bottom. The reason why I said slide master is I'm going to sort of stop for a second and show you where you can insert this information as you put that in. But this would be where most of your references are going to be in the background, maybe some in the methods if you're following somebody else's protocol. So I'm going to stop for 1 second on the PowerPoint and pull this back over here. So up here where it says view, there's a slide that says slide master. And what it actually does, if you go to this first one, that's the main slide master. It allows you to change this. You can make this color a little different. You can make the font a little different. And I would recommend if you go into your PowerPoint, you can edit that on your slide master. And then every time I get to my 4th level of indentation, it makes it for my reference. And so that's where I try to always keep that. These are usually the main words. Sometimes I'll go to 2nd and 3rd levels, but I rarely go to a 4th level of indent. So that's where I've saved that. And 5th level gets a little small. Once you save that, that's saved within that PowerPoint. It doesn't carry over to all your PowerPoints unless you save the design, which is another little trick up here, where you can do up here and you can have different slide designs that you've created. So this is one for Division of Athletic Training and other different ones that I've created over the years. So that's just a little PowerPoint trick to sort of help you with making life easier as you go through that. Go back to the slideshow. But I'm fine with you building on using the slides you had the last time and just working from those and adding to that. I would expect a slide that sort of summarizes the problem statement or the main problem that you're trying to address, and then your research question or your purpose. So that's the overall purpose of the study that will address those gaps. You might be able to get your hypothesis all on that. But a lot of times I think it's easier if you have the purpose and hypothesis on one slide or two and your problem statement sort of separate as you go through that. So this is sort of that representation. A lot of people will put the word of the heading up here, and it's somewhat of a waste when you say background, 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 and methods, methods. I sort of like having sort of like a topical sentence here. It sort of frames what this slide is about. The patient-reported outcomes are basically subjective. They're commonly used. This is starting to indicate that one of the issues with patient-reported outcomes, although they provide good information from a patient's perspective, they're often only identified every so often. And the purpose of what we're doing with our study is to look at these changes more over what we would do in physical therapy, like every week or two. So we're starting to identify, even on this first background slide, few outcome measures have tested the level of function and objective measures throughout rehab. So I'm starting to build the case for the need of the research. So it doesn't take very much. You don't want to sort of hide the headline. You want to get to the main point as soon as you can. So as you watch the video of me doing this presentation, I'm trying to make the justification for some issues, even in the first background slide. So this is perceived versus objective measures of function. So we identified discrepancies between measurements of subjective reported, which would be patient reported, and objective measures. So this again is sort of the rub, as I like to call it. We know that patients want to get back to full activity. Setting expectations really helps them to develop good therapeutic alliance and build confidence with our patients. So that's really a big component of that. So it's a challenge for us as physical therapists to set realistic expectations following rotator cuff or total shoulder surgery if we don't have realistic expectations for our patients. We know how tissues heal, but that doesn't necessarily mean we know when they'll be able to do functional activities. As you look in the literature, that information doesn't commonly exist. So that builds to the problem. And so these are the 2 or 3 points you want to make of what you're trying to address. Some of you are doing really exploratory, descriptive stuff. And so the information is we don't know what barriers exist for these populations with physical disabilities or mental disabilities in rural America. And so it can be that straightforward and simple. But so we do not know when function recovers during rehabilitation for shoulder surgeries. So it's not easy to set realistic expectations for a patient. We know long-term, 1 year out, where you're going to be. There's lots of literature on that, but patients want to know, where am I going to be next week or in 2 weeks? So we also don't know if subjective and objective function. So I've basically identified the problem, and then the purpose is going to answer those. Now I have tried to make comments where people say, do I need a research question and a hypothesis? No, it's just different types of studies. So some of you are doing exploratory studies where you don't really have a hypothesis, you just have a research question. Some of you have an expectation. I was talking to Elliot the other day that static stretching is going to work better than, I think you're doing foam rolling. So you don't have to have a question and a hypothesis. If you've stated the overall purpose and then you want to have one hypothesis, you're good to go. However, as you do that, you want to make sure that if you're going to have multiple hypotheses or a question and a hypothesis, you want to make sure you address that in your statistical approach. So as I go through this, I have different statistical analyses that I'm using to answer question one just to describe it. So that's a descriptive. The second issue is a hypothesis. We'll see a significant increase over time in perceived function. And then I have a third question is that objective functional recovery will occur earlier than subjective functional recovery for specific tasks. So as we go through that, we want to see if there's really a difference in time. There might not be, but we're going to look at that. So now when we get into the methods, basically this is where you're going to reiterate your study design and basically describe the key components out of your proposal. You're not going to be able to give tons of detail here, but you can give basic ideas of what your main inclusion exclusion is, if you're going to identify your recruitment, if you're going to do it from sample of convenience from the general population or from some kind of advertisement. Try to pick your main variables. If you have a lot of variables, try to pick the main one or two key variables. This might take 2 or 3 slides, and so you'll have to move along here. You can get weighed down with a lot of detail here, so just be careful with that. Try to describe what these tools are because we're not all familiar with all the different tools. I know I've been learning a lot about all of your research with some of the information as you go through that. The methods, this is going to be about 4 slides. You're going to talk about the instruments. That's part of that I just said. You're going to describe what you're going to do. It might not be completely clear. You might not have met with your advisor all the way through to get everything. That's okay. Write what you think is going to happen. I'm not the police that I'm saying, oh, you said you were going to do this and you didn't do it a year and a half from now. There's a lot of things up in the air because of COVID. So just try to make it as logical as you can. Even if you're sort of guessing at this point, that's fine. That's the same thing with the proposals. Write what you think you might be doing, run it by your advisor, and hopefully he or she will give you some feedback. The request that I am sort of making is that you want to make the problem and the procedures and the statistics all sort of match together. So if you say you're going to do descriptive data in your purpose, then don't do a t-test in your statistical analysis. Or if you say you're going to do a hypothesis and you're going to look for a relationship, don't talk about doing a t-test in your statistics. Those don't compute. Those don't make any sense. So based on your time limits, you might have to sort of be brief here, depending on how much information you have to share. So as I said in my example here, this is what I'm hoping to recruit. This is the basic inclusion. Exclusion criteria is they can't go to another physical therapy clinic, can't have had previous surgery. Those are my big key components. What are my basically methods? And I've sort of combined my instruments with my measures here. So I have 3 dependent measures: pin shoulder score, the shoulder objective functional test, and time. I have an independent variable of the different types of surgeries that we're going to capture. And then time is also an independent measure when I'm doing one of my questions, when I'm comparing the pin, shoulder, and soft scores. So time is sort of one of those variables that sometimes it's an independent variable, and sometimes it's a dependent measure, as it is in this case. So you can describe that as you go through it. A slide is probably plenty for each instrument. Pictures are worth 1,000 words. So if you're going to do some balance measurements or you're going to do something like that, the videos are hard to see, to import those. I would be careful with that. It's great if you can do it, but make sure it sort of works seamlessly so you don't have to go in and out of your PowerPoint. Pictures worth 1,000 words, and just try to keep it simple for this. So describe the instrument. This is a survey. It goes from 0 to 100. 100 means they have a good level of function. It has 3 components. Most of the score is related to function. I just put the Likert scale, and then there's the guy who invented this score has developed reliability and responsiveness. That's plenty of information to share with your classmates. And you might not have all of that, but as much of that as you can would be really good. The shoulder test, what is it? It's 16 yes/no questions. We record the date of successful completion. I gave a little example, so I don't have any videos of people doing this, but basically reaching above a shelf, combing your hair, tucking in your shirt. And then I put little asterisks by these to just represent that those are the tasks that I'm going to compare to the pin shoulder score. You can sort of see that these are high and low level activities, like heavy activities, like push-ups, throwing a ball. Those aren't common with total shoulder patients, but we also wanted to get people with unstable shoulders in this population. So an athlete might need to be able to go back to that. And this is sort of the spectrum of functional testing. So then I explained the procedures, how are we going to collect the data? What are we basically recording? How often are we recording that? And then I try to indicate that the patients aren't going to be doing any kind of intervention that's special for this. We're just going to follow their standard procedures. So that was 5 slides, I think. The shoulder objective functional test was 2 because it's new. So I was sort of sharing that. The last section, data reduction, and a lot of people I've talked to with meetings haven't needed a data reduction section. So you can just leave that totally off in your PowerPoint, and you can put NA in your presentations or just delete it completely if it's not appropriate. Statistical analysis should go back to those questions. So I wrote I was going to do a descriptive question and then 2 hypotheses, looking for something to change. So those are differences. So make sure those go right back to those main hypotheses. I understand you might have several questions. So remember, it's okay to sort of focus on 2 or 3 in your presentation just to keep it simple. I would like you to end your slide with significance. So where instead of a thank you slide, you can put that in if you want to, if you have time. But what I really want to end with is, what do you think the impact of this study will be directly related to your study? I understand there's a lot of long-term impacts on some of this research, but what do you think you'll be able to show or not show from your analysis? What's the most important point that you're going to gather? And that should sort of flow logically from the background, identifying the gap, and how your study has tried to identify, we now know the most common barrier, or we now know the most common insurance type of people who get good referrals for fracture management or from private insurance or something like that. So this is probably not a true data reduction. I put it in here sort of as an example. Only the people maybe doing balance studies or doing some kind of more technical component research, like the gait studies, where you're getting data from another system. If you're just reading numbers, that's not really data reduction, or that's not what it's meant. Here, I'm just sort of saying I converted days, the dates to days of surgery, and then basically identifying when the patient perceives that there's no difficulty in recording that date. It's probably a pretty weak data reduction example, to be honest. A lot of my research has been on EMG processing, or biomechanics, and we do a lot of description of how we analyze that data, and that's really what I meant. It doesn't look like many of you are doing that. So here's all I'm looking for stats. You don't have to run any data. You don't have to have any results. I'm just going to say, okay, for question 1, that's a descriptive analysis of the number of days for the pin shoulder. So I'm just going to describe the means and standard deviations of those scores. Hypothesis 1, so repeated measures analysis of variance will be used to compare the pin shoulder scores across the 2-week intervals. So over the 10, probably 20 weeks. So hopefully about 10 data points for rehabilitation. The days from the pin, shoulder, and soft will be tested for normality to determine the appropriate hypothesis. So I'm either going to do a parametric or a non-parametric analysis. I don't have to state which one. So the number of days from surgery for the pin shoulder score and the soft are compared with either a paired t-test or a Wilcoxon sign ranked. And all of that information I shared with you in the presentations that I've done. You all have had some of this in previous literature. So I'm doing a descriptive analysis of the number of days for the pin and pin shoulder and soft measures. So you'll get an idea of the dates when things are recovering. Repeated measures is a statistical analysis to compare multiple post-test measurements. So I can't use a t-test when I have more than 2. The non-parametric version of that would be a Friedman's test, but I think I'll probably have a normal distribution of that data. So I'm hoping I can do this with repeated measures. I would add in here, if you had a between group, that might be, you'll do an analysis of more of a mixed model repeated measures. We talked a little bit about that with Elliot's project the other day. And then the days from the pin, I'm basically trying to determine, did they get function back objectively or subjectively first? So I want to see if there's a difference between those. Is the days earlier for the objective or subjective measures? So then the last slide would be, the study will assist PTs to set realistic expectations and determine if objective or subjective reporting of function recovers at the same rate, or does one recover faster than the other. My hope is that they recover at the same rate so that the patient-reported outcomes are the same. I suspect the patients are a little scared, some of them, and might be a factor that they can do it, but they don't think they can do it well right away. So that's why I hypothesized it the way I did. So as you're looking, that's sort of the end of the presentation. Is there any questions, Katie?
I do not see any in the chat currently.
Okay. I can stop if anybody has a question on, I think y'all have done some presentations. Y'all are pretty good with this. If you're estimating your slides, probably between 30 seconds and 1 minute per slide, especially if you have several lines of text. That's a pretty good rule of thumb. I think I had about 14 slides in total. There's no set slide limit. If you're a fast talker and you want to put a lot of information or little information on a lot of slides, as long as you keep it within right around that 7 minutes, I'm good with that. I do recommend not trying to get too much onto one slide. 4 bullet points is probably enough. Keep the color schemes relatively simple. I've got a couple of examples of some bad color schemes here in a second. So strong black and white, yellow and blue, things are a little easier. And like I said before, I've put my UK template, the one that I'm presenting off right now. You can download that PowerPoint and use it if you would like. I have no problem with that. It's an official UK College of Health PT one if you like black and white. So you can sort of see on these, the Go Michigan beat Ohio State, because I'm a Michigan alum. Sorry for any of you Buckeye fans, but both my parents went to Ohio State, so I was the black sheep. But you can sort of see the Go Michigan beat Ohio State black on blue is really hard to read. The light blue and the blue on blue is hard to read also. Even though it looks really good on your PowerPoint, sometimes it's hard to read. So be careful with some of those contrasts. The bright colors on a dark background are dark black, blue on a white background or a light background is by far the easiest thing to do. Now I've noticed as the fancier PowerPoints, there's this designer image. So I went on and used it one time. So it'll try to grab stuff for you to make it sort of cool looking. I'm fine with using that. Don't go crazy with it. I don't know when that started happening on my most recent PowerPoint. It's never happened. So I guess the newer versions of PowerPoint, it'll make design recommendations. Sometimes you'll get situations like this, right? So over here, if I pull up my laser pointer, you get sort of this cutoff stuff. So you might want to hide that image or move stuff around. But you know, these are sort of nice. It breaks it up a little bit. It gets a little confusing sometimes as you do that. So I'm asking for a scientific presentation, not an educational presentation. So what I try to do when I teach you all classes is I'm teaching you, but if you go to a national meeting and you hear me speak, it's a lot different type of presentation. I'm just making more statements. I'm not trying to explain everything as I go. So it's very different. I don't know how much you guys have had the opportunity, but one thing you're probably gonna do as a physical therapist working for a healthcare system or for yourself is you're probably gonna wanna do some public talking. I went to the Scott County Library a couple of months ago and did a presentation on shoulder injuries. So I talk very differently when I do those kind of presentations. So you need to think about the audience and think of the format and how much graphics and stuff you wanna use as you go through that. I know watching myself on Zoom, I say way more than I should. I'm trying to stop doing that. I also hear people say like a lot. I'm trying to do a better job of doing that, doing less of that. I would also encourage you, and some of you guys are really good at this and some of you can work on this, is change your intensity. When something's really important, something's critical, whether you change your voice inflection is really important as you present. I understand it's gonna be a little nervous. It won't be so bad doing videos, I don't think. So hopefully that'll increase your comfort. When people haven't practiced, they really use the speech disfluency because they're searching for their word. So when I practice a presentation, as I mentor grad students as they get ready to defend their thesis or dissertation, it's pretty clear to me when they have and have not practiced, and you have to practice out loud. It's not sufficient to say, oh, I'm gonna say this, or yeah, I know what I'm gonna say with that one. You really have to practice out loud. So one of the advantages of Zoom now is you can do that and watch yourself. It's not comfortable to watch yourself, I get that, but it really helps you become a better presenter as you're doing that. Presentation to classmates, I think this is a really nice opportunity. Although it's mainly coming to me, I'm gonna share it back with you guys. You all might wanna share it with each other later just to get your classmates' input. This is a professional presentation, so I expect you to look professional as you do this. I'm gonna review the presentations. I'm gonna share it with your advisor. I think it's really helpful to teach yourself to be better presenters. Both your nonverbal and verbal presentation style influences that. So I put the rubric in the syllabus information. So I think that's pretty clear and straightforward. I'm looking for the outline of the problem, what is known, what is not known, how you'll go through examining that, how you will test the effect for the analysis. I would like you to sort of look professional. You have 7 minutes. I'm okay if it's 7 minutes and 15 seconds. I'm not going to dock you on that. I don't want a 10-minute presentation. Components are not completely worked out. I get that. Do what you can related to that. This is the scoring rubric. So I'm pretty fair evaluator. I'm trying to give you all the benefit of the doubt, looking for, what's in the bright yellow, a logical plan, your graphics sort of follow along with what you're doing, your clear voice, you're enunciating well. Remember, we're in a person profession, so we have to speak to people. I understand it's different presenting than talking to a patient or talking to a small setting. This is going to be done on Zoom, so you're not really having to face your classmates. So it'll be a little easier, I think, as they go through that. Try to give clear reasoning of why you're doing what variables you're using. Identify your research methods, your analysis, your components. And as I said, I'm just looking for, approximately 7-minute video as we go through with that. Any questions? See, there I am. I am going to stop that. Any questions?